sono canti che hai ascoltato già, desideri che attraverso I secoli han solcato il cielo.
Assalamu alaikum and good evening, dear viewers. Welcome to a brand new episode of Harmony of Life. I'm Walid Saleh, presenting this episode along with my colleague and co-host Camille Janvier. Camille, good evening.
Good evening, Walid. How are you this evening?
I'm perfect. How about you?
I'm good. I'm very good. And good evening to the viewers. Assalamu alaikum and welcome to another edition with us on Harmony of Life. And this evening we have two topics. Our first topic is going to be dealing with miscarriage. And with us to talk about this, we have Dr. Dغادة Gurab.
And later on in the program, we're going to be having Dr. Saad Al-Azhari talking to us about e-magazines, electronic magazines, later on in the program, which is our second main topic.
And of course, before this, we're going to look at the tweets that we've been receiving and compiling today, and that was on first aid. So let's look at the tweets you've been sending us.
And welcome back. Those were some of the tweets that we've compiled from Twitter on first aid and the tips surrounding first aid. Now, accidents can happen anywhere, whether in the house or in the car or in a picnic trip. So the most important thing to have in any first aid kit that will relieve you of having to go to the nearest emergency room, if the injury is not that serious, of course, you need to have sterile adhesive bandages in assorted size for simple cuts or abrasions. You need butterfly bandages and narrow adhesive strips. Individually wrapped sterile gauze pads, 2-inch and 4-inch, hypoallergenic adhesive tape to hold a dressing or splint in place, a roll of absorbent cotton as padding for a splint, sterile roller bandages, 2 inches and 3 inches, at least 3 rolls, cotton-tipped swabs, thermometer, anti-itch lotion or cream for relief of insect bites, itching, and minor skin irritations, and of course, last but not least, eye drops. And these are the things that, if you were compiling your own first aid kit, these are the 10 things that should be included in the first aid kit. Although I believe that first aid kits are usually, they come as a kit and they're complete with everything that you need.
Absolutely. They usually are, but I guess these are just extra things that you can add to make sure you've got as much as possible if you need any of these items. I mean, I have some completely different ones, but of course they're all important. Mine are the antiseptic ointment, a spray or towelettes for cleansing the wound, antibiotic ointment to prevent infection of minor wounds, bottled water to rinse wounds or for drinking, a face mask to protect against smoke, dust or allergens, latex gloves for protection when providing emergency help to an injured individual, a clean towel which can be used as a pillow or as a wrap for ice, chemical ice packs, emergency phone numbers such as your doctor, pharmacy, poison control, etc., and a first aid handbook.
If I were to choose between the two kits that I read and you read, I would choose yours.
Yeah.
This doesn't have an antiseptic. This doesn't have.
Yeah, but it has the gauzes and the various adhesive strips and stuff like that. You need actually both of these things. It's,
because I think in any injury, a cut or anything similar to that, it all boils down to pretty much sterilizing it, covering it, changing it every other day, and of course the anti-itch lotion and the mask and so on. These are pretty much to relieve symptoms, I guess, or something like that.
Definitely. But what do you think about in terms of us all having first aid kits? I think it's a really, really good advice that we should all at least have one, as you say, in the car, just in case you're out somewhere and
something happens.
Particularly when you have a family, when you have young children. But in any case, it could be a stranger that you meet that needs help.
Yeah.
So it's always good to like carry one in your car, but also you should have one at home, just like a fire extinguisher. These things are, you know, really, really vitally
better safe than
important.
sorry in any case.
Exactly. Yeah.
All right. In the meantime, let's move on to our first topic of the evening, which is understanding miscarriage. We are going to go with a report on that, and we'll be right back to introduce Dr. Dغادة, a consultant in reproductive endocrinology and infertility. Stay tuned.
Some types of fibroids may contribute to the risk of miscarriage, and removing them can improve the chances that women suffering from recurrent miscarriages will give birth to a live baby, according to research published in Human Reproduction. Here is some information about fibroids. They are benign, non-cancerous masses or fibrous tissue and muscle that may grow in or around the uterus. An estimated 3 to 10% of women of childbearing age have fibroids. They have been associated with spontaneous miscarriage, but their role in recurrent miscarriage is unclear. Researchers from the University of Sheffield used X-ray and ultrasound to examine the uteruses of more than 100 women with a history of recurrent miscarriage. One feature the investigators looked for in particular was the presence of fibroids, and if they were present, determined whether they were the type that distort the shape of the uterus. About 8% of the women were found to have fibroids. Among these women were 25 who had fibroids that distorted their uterus cavity and 54 that had non-distorting fibroids. The 25 women with the distorting fibroids underwent a minimally invasive procedure to have their fibroids removed, and subsequently none of them had another miscarriage during the second trimester of their pregnancy. Interestingly, the 54 women who did not have distorting fibroids and therefore did not have them removed also saw a drop in their second trimester miscarriage rate following referral to the Sheffield Clinic, which specializes in recurrent miscarriages, as did another 285 women with recurrent miscarriage and no fibroids at all. Today's research is one of the first to clearly link fibroids with miscarriage and the removal of fibroids with reducing the risk. It also shows, however, that treatment at a clinic specialized in miscarriage can also help reduce the risk of miscarriage.
Welcome back, everyone. And that was a report on miscarriage. And with us to talk about this very serious topic is Dr. Dغادة, who's a consultant in reproductive endocrinology and infertility. Welcome, Dr. Dغادة, to the program.
Thank you very much.
Thank you for being with us this evening. It's our pleasure to have you. First of all, if you can explain in simple terms, what is a miscarriage and why does it happen?
A miscarriage is a loss of any pregnancy, a fetus or embryo, before it can reach viability or it can survive. This has been defined by the WHO, which is the World Health Organization, as a fetus with a weight of less than 500 grams, which is equivalent to 20 or 22 weeks, which is around 5 months gestation. The causes of miscarriage, a lot of the time we can't know the cause. But most commonly, especially in the early stages, is due to abnormalities in the chromosomes. Chromosomes are the tiny particles that carry the genetic material, and during the process of development, they undergo a lot of duplication and replication. So any problem or any abnormality that occurs in any of those steps can lead to an abnormal chromosomes and an abnormal pregnancy. So that's one of the main causes. Other causes are like hormonal problems, like if there's an abnormality in the thyroid function. Thyroid gland is the gland that secretes a hormone called thyroid hormone, which if it's increased or it's low, it can affect negatively a pregnancy. It can cause a miscarriage, or a very high blood sugar, uncontrolled blood sugar, or an increase in the milk hormone. Other causes are like infections. For instance, there's like some kinds of cheese that contain a bacteria called Listeria monocytogenes. So there's certain types of cheese we shouldn't eat in pregnancy, and other types of infection that may cause a miscarriage. Elsewise, there's also sometimes we have, very rarely, some people have an autoimmune problem. That means the mother's body starts to recognize the pregnancy as a foreign body, and it starts to attack it. And with each consecutive pregnancy, the immune system, it attacks the pregnancy even more. So, but this is a very rare cause. Other also rare causes are like problems that may cause blood clots in the vessels that supply the pregnancy, and this may cause the fetal heart or the embryonic heart to suddenly stop. There's also lifestyle factors. Smoking, particularly more than 10 cigarettes a day, is associated with miscarriage. Drinking caffeine. Studies have shown that more than 2 to 3 cups of coffee a day, particularly American coffee, is associated with miscarriage.
Wow.
Yeah.
A lot of people don't know that factor.
A lot of people don't know that, yes.
And do gynecologists tell?
We do tell, yes. I make it a point to tell them.
Is it linked to it directly to the fact that you would go as far as telling the patient?
I would tell them. I definitely counsel them about many lifestyle factors. There's a lot of things in our diet that may cause you to have an increased risk of miscarriage or even decreased fertility. Excessive caffeine intake doesn't mean just coffee. Coffee, tea, even sodas, they all have caffeine in them. So an excessive intake of all of those is associated with miscarriage and decreased fertility.
Well, Dr. Dغادة, you were just mentioning the causes for miscarriage. But if I were to ask you the causes that make a miscarriage happen, they're kind of considered still misunderstood. When you mentioned chromosomal abnormalities, this is also a cause for Down syndrome. So how is there in people with Down syndrome, they have an abnormality? They have an
extra chromosome.
Extra chromosome. This is not considered an abnormality.
It is an abnormality, and a lot of pregnancies that have the abnormality of Down syndrome, that's an extra chromosome, end very early. Not a lot of them continue to full term.
So how do you diagnose a miscarriage?
You diagnose it by, the patient usually presents with bleeding per vagina and abdominal cramping. Could be either or both. That's the main way to diagnose it. And these are the symptoms, actually. When they come to us, we usually do an ultrasound scan. We want to see, have they passed the tissue in the fetus, or is it still intact? Is there a fetal heart still beating, or is it not beating? Because
so usually a woman would pass and not know.
No, she will pass. Sometimes the bleeding is so heavy that she will not notice whether she lost the fetus or not.
Oh, okay.
Because the bleeding could be mild, it could be moderate, it could be severe. So it depends on the symptoms.
So when is the crucial time for a miscarriage to occur? Is it the first 3 months? Because you're often told that, well, women are told that if you're having a baby, don't tell other people until you've passed the first trimester.
That's right, because it most commonly occurs in the first 12 to 13 weeks of pregnancy, which is about the first 3 months. The percentage of it occurring after that is 5% or less.
Okay. So, and then if a woman does feel herself at some point in her early pregnancy or later on, but she feels herself getting stomach cramps and they're really quite severe, should she immediately go and seek her doctor's opinion?
Stomach cramps in the early parts of pregnancy, if it's not associated with bleeding, usually it's not that much of a concern, unless it's really severe. Sometimes we'd be worrying that it might be a pregnancy outside of the womb. It might be in the fallopian tubes or somewhere else. Ectopic pregnancy, exactly. So she should seek medical advice to rule that out. But a intrauterine or a pregnancy inside the womb, the main symptom actually is bleeding, especially in the early stages. If it's an early miscarriage. If it's later on, like in the 4th month of pregnancy, she could present just with pressure symptoms or just pain. She doesn't necessarily have to have bleeding. So The thing is, it's normal to have a bit of cramps at the 4th month, the 3rd month. It's normal, but when it becomes more severe, yes, definitely she should seek advice. Yes.
Yeah. So, doctor, how prevalent is this phenomenon of miscarriage? How often does it occur, and how many women?
Miscarriage occurs in 15 to 20% of all recognized pregnancies. Recently, research has shown, they did studies on, they did what they call a beta-HCG, which is the hormone that's released by a pregnancy, on all women before they missed their period or so their cycle. And they found that many of them have a pregnancy that they didn't even recognize, and that later they just thought when they got bleeding later on it's just their cycle. So when they put the percentage of all recognized and unrecognized pregnancies, it goes up to 60 to 70% risk of chance of a miscarriage of all pregnancies. But of recognized pregnancies, where you know you're pregnant, the chance is around 15 to 20%, and it increases with age.
Yeah, of course. Yeah.
Wow, that's a big number.
It is a big number, yes.
Very big.
Yeah.
Well, we're going to go with a report right now, and we'll be right back to continue with Dr. Dغادة, consultant in reproductive endocrinology and infertility. Stay tuned.
Victoria is 5 months old, but at one point her mother wasn't sure she'd ever have a baby. Charlotte had 6 miscarriages before she delivered Victoria.
Yeah, it was frustrating because you're pregnant and you're not. You're pregnant and you're not.
Chromosomal abnormalities are one of the main reasons for miscarriages. But at Houston IVF, women who have had multiple miscarriages are being offered a new technology that allows infertility specialists to find the embryo most likely to survive.
We can actually find the embryos that are chromosomally normal and only transfer the normal ones back.
They biopsy the outer cells, not the embryo itself. That makes the test less invasive and more accurate.
Well, it's potentially used for people with a lot of miscarriages, for women that are older that are more likely to have chromosomally abnormal embryos, or let's say they've gone through IVF several times and produced many embryos, but they keep miscarrying or they don't implant.
It's an additional $5,000 above the cost of in vitro fertilization. But this biopsy procedure is helping women avoid the physical and emotional strain of repeated miscarriages.
In the first 13 we did, 11 of those, and these are women that have never had a child, 11 have already have a baby now.
For Charlotte, the first time she used the procedure, all of her embryos were abnormal.
I was actually happy in a weird way that we were able to test the 10 embryos, and unfortunately 0 were chromosomally normal. But at that same time, it saved me from having a 7th miscarriage.
In her second procedure, she had 1 normal embryo, and that became Victoria. Now turning 40, she's undergoing the technique again, hoping for 1 more healthy baby.
Welcome back, everyone. And of course, the last report still dealing with miscarriage. And with us to continue this discussion, we have Dr. Dغادة, who's a consultant in reproductive endocrinology and infertility. Welcome back, Dr. Dغادة.
Thank you.
So, continuing with our discussion about this problem, shall we say, and how possible is it for a woman who's had a miscarriage to get pregnant again? What are the,
if it's just 1 miscarriage, she has a 90% chance of having a normal full-term pregnancy after that. If she's had 2, the percentage goes down to 80%. That's why we don't need to do any costly investigations or do anything unnecessary after 1 or 2 miscarriages usually. So usually we reassure them that everything will be okay in the future.
Yeah. So, and also you say it's miscarriage is obviously higher due to the older a woman gets, the more likely it is to happen.
Yes.
And how likely is it, for instance, for a young person to suffer from miscarriage? Is it almost the same percent?
For between the age of 20 and 30, the percentage is 11 to 12%. This percentage between 30 and 40 years old goes around to 15%. 40 to 45, it goes up to 30%. Above 45, you have a 50% chance of having a miscarriage, if not more, because the chromosomal abnormalities become much more frequent, because it changes the egg quality and so on, age.
Sure.
Yeah.
Well, Dr. Dغادة, what about miscarriage in the medical community is misunderstood, sort of, or not well understood, considering the causes and so on. But in terms of for the general public or in the society in general, what are the most common misconceptions surrounding miscarriages?
The most common misconception that I wish would change in everybody's mind is that lying in bed for 1 or 2 or 3 weeks, and some people even for months, will somehow decrease their chance of miscarriage. They did research on thousands of women, and they found that lying in bed, the only thing it will do is increase their chance of having a blood clot in their legs or their lungs, so it could threaten their life eventually.
Wow.
Because it will not decrease at all the risk of miscarriage. So many women come, oh, I'm going to stay lying, but she has a bit of bleeding. I'll lie in bed for 2, and they stay for weeks, and they get depressed, and it does nothing other than increase their chance of having blood clots.
So where did this misconception come from? Not moving is gonna...
It's in a lot of societies that they have this misconception. Women when they sit with each other, oh, you have to lie down. They think if you rest, somehow it's going to stay in place. But no, in fact, it's not.
But what about...
If it's meant to be, it's meant to be. If it's not, it's not.
Sure. But what about women on the other end of the scale who exercise to an extreme or keep going to the gym as they used to do before they were pregnant? Is this also dangerous?
No, any exercise that a woman was doing before pregnancy, she can continue to do during pregnancy, except with supine exercises where you're lying on your back and weightlifting exercises. It's not recommended. Elsewise, if she's doing aerobics, she can continue to do aerobics. The only thing that's not recommended is that if you weren't doing exercise before pregnancy, you really shouldn't start doing exercise when you're pregnant. You shouldn't start doing aerobics because your body's not used to it.
Yeah.
But there's, if you see abroad, a lot of them continue.
Till what trimester can they keep doing?
Till whenever they still can. Because usually by the time you reach your 8th or 9th month, you're too tired and heavy to be able to do aerobics like you used to.
Of course, yeah.
But it doesn't harm.
Even sit-ups?
No, that's lying on your, any supine, which is lying on your back, this should be avoided. And weightlifting.
And weightlifting.
Yes.
Right.
And sit-ups you can't anyway.
Exactly.
Structurally you can't. Yeah.
That's why I asked. Yeah. Well, Dr. Dغادة, I'd like to thank you very much for being with us on the program and shedding light on
Thank you. The pleasure was all mine. Thanks a lot.
And that was our guest, Dr. Dغادة, consultant in reproductive endocrinology and infertility. We'd like to thank her again for joining us in the program. And we're going to go on a report now introducing our second topic for the evening, which is e-magazines. Stay tuned.